Make a way up during surgery and not be able to move. So here we go. Have you ever had anyone tell you they woke up in surgery? I've read online that it can happen and your body is unable to move, but your brain is aware and can cause PTSD if it does happen. Can you make sure I'm dosed up enough to stay asleep? Right. Now, and also, Olivia's come in saying that my friend's mum woke up during surgery. Dear God, wouldn't wish that on me. So that's a real life example there. Right. Okay. Well, I've never seen it happen. And I've never been around or spoken to anyone who that has happened to. I have seen it on telly, but I've never seen it in real life. The reason that it's very unlikely to happen is that you are monitored during your surgery. You're monitored. Your observations are being monitored. Your pulse and your blood pressure are being monitored continuously. So if there's any evidence that your anesthetic is becoming lighter, you're beginning to wake up, you're getting light with your anesthetic, your pulse will go up and your blood pressure will go up because that demonstrates you're feeling pain. If there's any evidence that the anaesthetist will be monitoring this, and if there's any evidence that you're feeling pain, if your pulse rate starts to rise, which will be the first indicator that you're starting to feel pain, then he'll give you more anesthetic. So what you're describing there is very unlikely. And the thing about not being able to move is if you're paralyzed. Now, we don't usually paralyze you, but so you can see how it happens, because if you have muscle relaxants, you're paralyzed, and on paper it could happen, but the anaesthetist would have a warning that you are coming at lighter in your anesthetic by your observations. Your pulse and your blood pressure would rise, and it would be obvious that you're becoming lighter in your anesthetic. So I've never seen it happen, and I've never been around anyone who's it's ever happened to, and never spoken to anyone who's ever happened to. So as I say, on paper it's potential, but the anaesthetist would have to be pretty much not on the ball to miss that. And certainly all the anaesthetists that we work with are on the ball. And we can see the anesthetic monitors when we're doing the surgery, so we can see, and it goes beep. That's the machine that goes beep. It will go beep 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 beep. Your blood pressure will be going up. So yes, I can reassure you that won't happen, although Olivia's straight in there saying it did happen to her friend's mum. But I can reassure you that is very unlikely to happen, because we are on it and we make sure that sort of stuff doesn't happen, and you will be fine. Similar like when we do it under local and sedation. So some people aren't even under anesthetic, and we do it. And again, we monitor those things, the blood pressure and the pulse, to check people are comfortable and not in pain. And if it looks like they're in pain, then we give them more anesthetic or put them to sleep or whatever. But we make sure that you're not in pain when you're having the surgery, and pain is registered way before you're awake. Your body will react to it before you're awake.